to rectal mucosa, most likely diagnosis, Hirschsprung disease. Now you can see this cone-shaped defect also. You can see proximal thyroid colon and distal narrowed colon. Also, you can see like this one also, that contrast anemia shows thyroid streamoid colon with narrowed, fully sensible rectum and persistent corrugated appearance to the rectal mucosa. Diagnosis: Hirschsprung disease. 2048. Which period would favor diagnosis of juvenile polyposis rather than familial adenomatous polyposis? Total of 10 polyps in the colon. Out of all the options, these are the best. Which period would favor diagnosis of juvenile polyposis rather than familial adenomatous polyposis? Total of polyps of 10 polyps in the colon. 49. Phenpinum shows collapse of lower thoracic vertebra and increased density, most likely diagnosis is granuloma. This is called vertebra plana. So the intrapleural granuloma, skull lesion, the parietal bone. So this is also vertebra plana seen. The plane film is collapse of lower thoracic vertebra with increased density. Vertebra plana. Diagnosis: eosinophilic granuloma. Now eosinophilic granuloma skull shows sclerosed lesions with prevalent margins. Vertebra plana. DT is chance fracture, component fracture, metastasis. Question 50. The CT scan shows the large ball is incidentally noted to be lying on the left side of the abdomen with a small intestine on the right side. The superior mesenteric artery lies to the right of the superior mesenteric vein. The most likely diagnosis: non-rotation. This is non-rotation. In non-rotation, okay, let's read this. Intestinal malrotation. Intestinal non-rotation is a congenital anomaly of the intestine that results in a small bowel occupying the right side of the peritoneal cavity and the colon on the left. Colon on the left, small bowel on the right. In non-rotation, congenital anomaly, colon on the left and small bowel on the right. In CT scan, what do we see? The large bowel incidentally noted to lie on the left side, abdomen with a small intestine on the right. The superior mesenteric artery lies to the right of the superior mesenteric vein. Mesenteric artery lies to the right of the superior mesenteric vein. Most likely diagnosed: non-rotation. Correct? Superior mesenteric artery will be here. Superior mesenteric vein will be here. Question number 51. MRI shows stringohydromelia and tonsillectomy of 7 mm within fourth ventricle in normal position. Most likely diagnosed: GI1 malformation. Now, MRI shows stringohydromelia and tonsillectopia and stringohydromelia, most likely diagnosis within fourth ventricle, most likely diagnosis: GI1 malformation. Tonsillectopia of 7 mm within fourth ventricle in normal position and stringohydromelia, diagnosis: GI1 malformation. This is number 52. Antenatal ultrasound at 31 weeks scan shows hair drops, cardiac enlargement, and hydrocephalus. Therefore, most likely associated ultrasound findings: cerebral medial tubular cystic space with high velocity color Doppler flow. Diagnosis: vein of canal malformation. It can show congestive heart failure. This is cardiac enlargement. So, how you describe it? Is cerebral median tubular cystic space with high velocity color Doppler flow. The diagnosis: vein of canal malformation. Antenatal ultrasound at 31 weeks shows hair drops and cardiac enlargement and hydrocephalus. Which are the following most likely associated ultrasound findings: cerebral median tubular cystic space with high velocity color Doppler flow. 53, sorry. 18-month-old child has cutaneous bruises and burns. Radiograph shows posterior rib and long bone fractures of varying ages. This is most likely finding on CT of the brain: subdural hematoma. Now, 18-month-old child has cutaneous bruises and burns. So these are non-accidental injuries. Radiograph shows posterior rib and long fracture of varying ages. So more non-accidental injuries. Most likely finding on CT of the brain: subdural hematoma, which is also non-accidental injury. 54 ultrasound scan shows large echo-free septated cystic collections on both kidneys, causing scalloping of the renal outline. On CT, you have collections of close to water density, most likely diagnosis, renal lymphangiectasia. Now, what collections are shown in the kidney outline, and then they are close to water density, so renal lymphangiectasia. Other lymph nodes rise from lymph nodes. Ultrasound scan large kidneys and then cystic collections around them. We have close to water density on CT, what I diagnosed renal lymphangiectasia. 55. 15-year-old female whose father had progressive renal failure, presents anemia, polyuria, and hematuria. On ultrasound scan, her kidneys are small and smooth. Where surgery finding most likely nerve deafness, diagnosed Alport syndrome. And this the finding is that female father had progressive renal failure, presents anemia, polyuria, and hematuria. So her father had progressive renal failure, so most likely Alport syndrome. Then her kidneys are small or smooth on ultrasound, most likely diagnosed nerve deafness. Most likely surgery finding nerve deafness, diagnosed Alport syndrome. 56. Mandatory respiratory distress shortly after birth. Chest radiograph shows HO in the left upper zone, which improves over the next 7 days. Chest radiograph becomes normal. 2 months later, chest radiograph shows hyperlucency in the left upper zone, with contralateral mediastinal shift and compression of the adjacent left lobe, most likely diagnosed congenital lobar emphysema. 2 months later, chest radiograph shows hyperlucency in the left upper zone with contralateral mediastinal shift and compression of the adjacent left lower lobe, most likely diagnosed congenital lobar emphysema. 57. A 6-year-old boy, 1699 ampertendage study shows small focal area of increased activity in the right lower quadrant 5 minutes after tracer injection, which increased in intensity with time paralleling the activity of the stomach, most likely diagnosed Meckel's reticulum. Now, on technetium 99 ampertendage study, focal area of increased activity in the right lower quadrant 5 minutes after tracer injection, and which increased intensity with time paralleling the activity of the stomach, so diagnosed Meckel's reticulum. Increased activity paralleling the activity of the stomach, most likely diagnosed Meckel's reticulum. 58. A full-term baby boy born to a diabetic mother. Abdominal graft shows dilated meconium filled functional colon to the level of the sphenic flexure with an empty descending colon, sigmoid colon, and rectum. Vegetarian waterful cerebral enema results in presence of meconium. Baby is discharged well 2 days later, most likely diagnosed meconium plug syndrome. Abdominal X-ray in contrast enema demonstrating multiple tubes of dilated bowel proximal to a colon packed to retain meconium. Features are consistent with meconium plug syndrome. The dilated meconium filled proximal colon to the level of the sphenic flexure with empty descending colon, sigmoid colon, rectum, and material water soluble enema results in presence of meconium, diagnosis meconium plug syndrome. Or you can see multiple pallet shaped defects seen in the bowel loops. 759. Chest radiograph shows lucency in the right lower zone, and an expiry film demonstrates air trap in the same region as well as meningeal shift to the left, most likely diagnosed foreign body aspiration. The child chest radiograph shows lucency in the right lower zone, and expiry film demonstrates air trapping in the same region as well as meningeal shift to the left, most likely diagnosed foreign body aspiration. None of the other options make any sense. 59. There's air trapping and lucency in the right lower lung zone. Question number 60. 2-year-old girl abdominal pain or sounds of echogenic intramural mass in the duodenum, keeping with intramural hematoma. There's mild proximal dilatation of the duodenum and small amount of fluid within the abdomen, most likely cause non-external injury. They are saying that hematoma, intramural hematoma, is seen as intramural mass in the duodenum, keeping in with intramural hematoma, most likely cause non-external injury. Intramural hematoma most likely cause non-external injury. 61. A 7-year-old boy with colicky abdominal pain and rectal bleeding has purpuric skin rash on external surface of arm and legs, most likely finding on CT scan of the abdomen, multifocal bowel wall thickening. Diagnosis is Hellas continent purpura. Now, 7-year-old boy with colicky abdominal pain and rectal bleeding, purpuric skin rash on external surface of arm and legs, most likely cause of the finding on CT scan of the abdomen, multifocal bowel wall thickening, with a diagnosis is Hellas continent purpura. 62. Boil after falling on his bike. CT scan shows free petroleum fluid with a more focal collection of fluid as the mesenteric root. Adrenal finding of mesenteric stranding and focal bowel wall thickening are seen. There is diffuse homogeneous hypertension of the pancreas, kidneys, and bowel wall, most likely due to mesenteric rupture. This is mesenteric injury. So, a CT scan shows free intraperitoneal fluid with a more focal collection of fluid at the mesenteric root, and there's also mesenteric stranding and focal bowel wall thickening are noted. There's diffuse homogeneous hypertension of the pancreas. You can see over here the pancreas, kidneys, and bowel wall, most likely diagnosis in mesenteric rupture. This is bowel injury. Okay, so free intraperitoneal fluid with more focal collection and the fluid at the mesenteric root, and mesenteric and bowel wall stranding and focal bowel wall thickening, diagnosis mesenteric rupture. Question 63. Film of the lumbar spine reduced the space between the second and third lumbar vertebrae with loss of clarity and clears. What will educate most likely help make diagnosis? MRI. Back pain plus paraxia.